outbreak of COVID-19, General Secretary Xi Jinping have made many instructions and guidance, and he emphasized that we have to provide a lot of support to attend to the elderly care institutions, welfare institutions for children, and welfare institutions for mental health. Recently, the Central Leading Group and the State Council, State Agency Task Force have launched many documents on epidemic prevention and control in the areas of civil affairs. All of these documents will provide more support to the frontline community workers in urban and rural areas, and also help to ensure the livelihood guarantee to people with difficulties. This has demonstrated that the State Council and CPC Central Committee has attached great importance to people at the grassroots, and also it shows the institutional advantage of our Constitution. And it also encourages our civil affairs workers to live up to the mission and meet people's expectations. Since the outbreak of the epidemic, the civil affairs spare no efforts to move along with the anti-epidemic prevention and control. We also focus on the economic and social development of the society, and we have focused on 5 areas of work. First, we strengthen the organizational leadership and implement decisions and deployments made by the State Council Interagency Task Force. For the Party Committee of the Civil Affairs Department, we also established a party branch when we supervise the donations, charities, and made a lot of arrangements in the epidemic prevention and control in the civil affairs services. And also we hosted the 13 meetings to convey the spirit and instructions made by General Secretary Xi Jinping and CPC Central Committee. We also formulate a series of guidelines to make sure that we can implement a detailed arrangement of all the tasks. And also we focus on the support to Hubei and Wuhan city. We strengthen the supervision and the donations to those regions. And also we send out notifications to charity agencies across China. And we will prioritize the donation to Wuhan and the Hubei province. And also we send out 3 working groups to provide guidance in the Wuhan and also supervising the donation work that's happening in the Hubei province. And also we are organizing a team of 118 workers to provide support in the elderly care institutions in Hubei province. And also we are providing a lot of temporary support to the non-local residents in Hubei province. Third, we mobilize all forces to participate in the epidemic prevention and control. And also we are launching a grid-style management for the communities in the urban and the rural areas. We'll make sure that we can utilize the joint efforts to fight against the COVID-19. And also we take coordinative efforts to provide more support and care to the frontline community workers in urban and rural areas. We work with charities, organizations, and the community service centers to take targeted measures and to fight against the COVID-19. Fourth, we take concerted efforts to address problems from the vulnerable groups. We also launch a series of notifications and guidance to provide instructions to the elderly care institutions, welfare institutions for children, rescue and protection center for juveniles, welfare institutions for mental health, and funeral services. We also provide a lot of support to these agencies. And for some civil services facilities, we also do a lot of disinfection and ventilation to reduce the risk of cluster outbreak of the epidemic. At the same time, we are also strengthening our work in the civil services departments to make sure that the civil services can be operated in an orderly manner. And fifth, we are also taking targeted measures by regions and risk levels to resume the work and production. For some regions, it is possible to resume the work and production in an orderly manner. And also we can provide the services of the provide guidance to the civil service organizations to resume their work. And we will pay special attention to special groups, including the life behind children, the life behind elderly, juveniles, and the elderly person of no families. Even though we are faced with the impact of the epidemic, but we are making sure that these people can be attended. So in general, with the strong leadership of CPC Central Committee, with our joint efforts, we have basically met the needs of our people and ensure the epidemic prevention and control work can be conducted in an orderly manner. I want to emphasize that the grassroots officials and the frontline community workers, they have made a lot of dedications and contribution to protect people's life and safety. And also, we have a lot of touching stories, and we hope the journalists can cover their stories. At the same time, we do see some weakness, and please provide some suggestions and feedback to us. Going forward, we will continue to learn the spirit from General Secretary Xi Jinping to take coordinated efforts to improve the epidemic control and economic and social development, so that we can fully implement the 3 important documents that issued by the Central Leading Group and State Council Interagency Task Force. So we are doing what we can to make sure that we can win the people's war against the epidemic and strive to build a moderately prosperous society. That's my update. Thank you. Now the floor is open for questions. Please identify yourself before you raise the question. CCTV. We're aware that there are some cluster outbreak in the elderly care institutions in Hubei province and other provinces. So I want to understand the current situation about the epidemic control in the elderly care institutions, welfare institutions for children, and other welfare institutes. So can you give us some update on that? Thank you for your question. I will take your question. First of all, I would like to give you more introduction about the civil service organizations. For these organizations, it includes the elderly care institutions, welfare institutions for children, welfare institutes for mental health, and relief centers for migrants and funeral services. So that is to say, we have 5 categories in these organizations. So altogether, we have over 45,000 institutions. We admitted around 2.5 million people. And also we have 1,181 funeral services across the nation. In the past few months, we focus on the epidemic prevention and control in Wuhan. We have already launched the close-off management for all of these organizations. We also run NAT tests to all of these organizations, and also we have bring all these people to hospital to be treated and admitted as needed. And so for the epidemic prevention and control in the civil affairs areas, we are adopting a territorial principle. So all of those guidelines are actually issued by the local governments. Since the outbreak of the epidemic, Civil Affairs Ministry has attached great importance to the for the prevention and control work in the civil service organizations. I have just gave you some updates about that. We have focused on 4 areas. First, we will strengthen the supervision. So the supervision will go down to different levels of the authorities and the government. We have sent out 8 working task force to these organizations. Also, we are providing classified guidance. Altogether, we have released 18 documents. And third, we will spare no effort to support the civil service organizations in the hard-hit regions. We have 2 directors leading the task force and to provide guidance, to attend to the elderly care services and donations. Fourth, we also form investigation group to understand the current situation. For example, we will provide some support to people with difficulties, especially for those non-local residents who are staying in Wuhan, and we will work with the Wuhan local government to provide support to these people. All in all, these measures are quite effective. But we understand that for the civil service organizations, they are densely populated, and also they are collecting a lot of people of elderly person of no families, orphans left behind, children left behind, elderlies, and these people are vulnerable groups. And also for the funeral service centers, they have to cope with the cadavers of the deceased, so they may have a high risk of infection. So we have to focus on the key links. And we will continue to implement the existing measures and to draw on the experiences. That's my update. Next question. With Hong Kong Economic Daily, since the outbreak of epidemic, some people are facing with some difficulties. They may not be aware of some of the rescue work and also the measures released by the Civil Affairs Ministry. So how can you cope with these problems? So actually we have a department for social rescue. I will give the floor to Mr. Liu Xitang to take your question. Since the outbreak of the epidemic, it posed a lot of challenges on the social rescue. We have taken a lot of measures, and because of the epidemic, some of the social rescue work were affected. In order to respond to the people with difficulties, we also take a lot of measures. We're making sure that we can help and save those who are in need. This is our guiding principle. Since the outbreak of COVID-19, Civil Affairs Department has actually released a lot of measures. And also the Central Leading Group and State Council Interagency Task Force also make some arrangements and deployment. In dealing with people with difficulties, we have focused on several areas. First of all, we have simplified our working procedures. For example, the basic living allowance program. In the past, we have to go door to door and make on-site registration. And this time, we are actually doing a telephone interview, and we are making use of big data to understand the situation of the families, to make sure that people who are in need can be included into the basic living allowance program. And for people who are already receiving the basic living allowances, we will continue to support them with the living allowances. So we simplify the procedures. And second, we will encourage all localities to make use of the information. So the Civil Service Department at all levels have been taken an online registration so that we can receive applicants who are applying for the basic living allowances. So for example, in Sichuan province, they have already set up such an online platform to handle some of the cases that need the basic living allowances. And also, we are giving more approval authorities, to the localities, especially for temporary rescue. Some of the local communities, they can be empowered to offer basic living allowances to people who are in need. For example, if some community officials, they found some families are in difficulties, so that they could offer help first, and later on they can explain to the upper authorities. Third, we also encourage the localities to open up hotlines. As of now, we could see many places have implemented an isolation and quarantine measure. So if people are faced with difficulties, they can call to the authorities and seek for help. So we have the hotline from the State Council Interagency Task Force. We also have the 12345, which is the hotline for localities. And going forward, the Civil Affairs Ministry will also collect all of those requests from different regions. And we will publish this information online. This is one aspect. And also we will strengthen the education of the policies and the measures. Since January the 29th, the Civil Affairs Ministry, together with the Central Leading Group and State Council Interagency Task Force, has already issued several documents to alleviate the epidemic prevention and control. And we have to educate the general public to further understand all of these documents. So you could find out all of these documents published on our official account on the internet. And please help us to educate this information to the general public. Thank you. China News Service. As Mr. Zhang just said that the Central Leading Group has released measures to support the frontline community workers in urban and rural areas. Can you tell us more about the measures taken by the Civil Affairs Ministry? Since the outbreak of this epidemic, we actually have a new department set up, which is the Grassroots Construction and Social Governance Department. So I will give the floor to Mr. Chen to give you some elaboration. First of all, thank you for your attention to the measures to support frontline community workers. It is important that we ensure the safety for the community in urban and rural areas. Since the outbreak of the epidemic, the frontline community workers have earnestly implemented the decisions and deployment made by the CPC Central Committee and the State Council. They are working diligently at the front line to fight against the COVID-19. They have made a lot of contributions to curb the spread of the virus. As of March the 8th, 53 frontline community workers lost their lives in fighting against the epidemic. 92.5% of them are CPC members. General Secretary Xi Jinping have made instructions on many occasions to show support and cares to the frontline community workers. Premier Li Keqiang also made guidance and instructions on many times in order to fully fulfill the deployment and instructions made by the CPC Central Committee and better fight against the COVID-19. The Party Committee of Civil Affairs also carefully study the difficulties that has been faced by the frontline community workers in urban and rural areas. We have clarified our responsibilities and duties. We have made 8 guidelines to resolve the 5 problems. First, we are set up a measure to improve the living allowances to frontline community workers in urban and rural areas. When necessary, we will offer living allowances to frontline community workers. The local government can study the actual situations and set up the subsidy guideline. And second, for frontline community workers who are suffering from the work injury or being infected with COVID-19, these people will be considered as the work injury. And also, the localities will grant compensations to pay these people. And if they generated some bills in treating of the COVID-19, these people will be compensated by the local fiscal authorities. And also, the local finance should improve the condition of protection for these frontline community workers. For example, these people will be offered with facial masks, protective suits, goggles, disinfectants, etc. Fourth, we will firmly reject formalities, bureaucracy. And the document has clarified that we will reject redundancies. We have to streamline the procedures. And the localities should not deploy tasks at community level. And also for the localities, they should not ask for additional documentation or certifications that are provided by the communities, except for the quarantine certificates. We should reject bureaucracy formalities. We have to strengthen the supervision. We do found one of the misconduct in the Qingshan district of Wuhan city. This is not acceptable. We have to correct all of these wrongdoings. Fifth, we will strengthen our efforts to provide publicity of the role models and offer awards to those people who have made tremendous contribution in fighting against the epidemic. For those frontline community workers who have lost their lives in fighting against the epidemic, and they will be awarded afterwards. And also we have to ensure that some of the people can be included into the martyrs list. Thank you.
谢谢主持人。中国社会报记者提问：我们了解到，这个疫情发生后，武汉养老院
We are aware that since the outbreak of the epidemic, some of the elderly care institutions in Wuhan are running short of the healthcare workers. Some of the people have been working for long hours. And we also see it in one of the documents for the epidemic prevention and control in civil service organizations. They have emphasized that we have to provide more support and care to the healthcare workers. Can you tell us more about the measures taken by the civil affairs Ministry. I will give the floor to Mr. Yu Jianliang, the Director of the Elderly Service Department. So for the elderly care workers, you may not be familiar about this work. These people are under intense pressures. Currently, we have over 2.5 million elderly people who are living in those elderly care institutions. However, we only have 370,000 elderly care workers to serve these people. So you could see the workload is very heavy, especially for those elderly care workers. They have to provide service in 24 hours. And for each one of the elderly care workers, they have to serve around like 10 elderly people. And also some of the elderly person, they're not able to look after themselves. That is to say, it is a very tough job for these elderly care healthcare workers. However, if we look at the income of those elderly care workers, they are not well paid. So since the outbreak of the epidemic, we do see some of the elderly care institutions are running short of the manpower to take care of the elderly people. And during Spring Festival, some healthcare workers travel back to their hometown. Because of the epidemic, these workers are not able to return to their positions in time, which results in a severe shortage of the elderly care workers. After we close off the elderly care institutions, for these elderly care workers, they're actually living inside of the elderly care institutions. That is to say, there's no work rotations for these people, which will bring more pressure to these healthcare workers. The situation in Wuhan is more prominent. Now we have over 23,000 elderly people living in the elderly care institutions, but we only have 3,000 elderly care workers available in Wuhan. And for some healthcare workers, they are actually infected by the COVID-19, which gives a further hit to the number of available healthcare workers in the elderly care institutions. But I would like to point out that since the outbreak of the epidemic, since we closed down the elderly care institutions, the existing elderly care workers, they have been working day and night to look after the elderly people. I would want to extend my highest tribute to these people for their contribution and dedication. As you mentioned, now we are running short of number of healthcare workers. The Civil Affairs Department has already issued some measures. As for Wuhan, which is the epicenter of the epidemic, we have taken a lot of measures. In Wuhan City, we are offering a measure to support the cross-regional support in elderly care. We take coordinative efforts to mobilize healthcare workers from 3 provinces to work in Wuhan. And in Hubei province, we also mobilize 50 healthcare workers from 4 cities in Hubei province to provide support to Wuhan. That is to say, in total, we have 168 elderly care workers being mobilized across the nation to support the epidemic prevention and control work in the elderly care institutions in Wuhan. And also some of the medical teams are led by the head of the elderly care institutions across the nation. On this special occasion for these healthcare workers, they are putting aside their personal interest and fight at the front lines in Wuhan. It also demonstrates the spirit of boundless love for these people. This is the first measure, that is the cross-regional assistance. Second, for the service of elderly care, we are heavily depending on the available resources in the elderly care institutions. So as I have just mentioned, we have mobilized resources from 3 provinces and 4 cities. However, these medical workers can only attend to the elderly people in 8 elderly care institutions. So we have to still focusing on the services that provided to the rest of the elderly care institutions in Wuhan. And we will do what we can to provide more trainings to the new healthcare workers so that these people can resume their work at an earlier date. So this is also an issue in relates to the work production and resumption. So for our ministry, we also taken a targeted measures by regions and risk levels. For example, in counties and regions with low risk levels, with the unified leadership of the local government, if we can ensure that all the protection can be ensured, we encouraged the local elderly care workers to go back to work. So that is to say, if these people are living in a region that have a low risks, so we can relax their quarantine restrictions, and then these people can go back to work. For those workers who are living in the medium and high risk regions, they still have to follow the instructions and regulations offered by the Civil Affairs Department. And these healthcare workers have to be self-quarantined for 14 days, and then they can resume their work gradually. Thank you. We all note the epidemic has caused a lot of impact for the daily life of our people, especially it will affect the life of people with difficulties. So what measures will be taken by the civil affairs to ensure that these people will not be affected? So thank you for your attention to people with difficulties. As you have just said, the epidemic will have an impact on all the people. In particular, people with difficulties will be badly struck by the epidemic. And we found that some of the living costs has been increased by these people. And for people with special needs, we have to give special attentions. On January the 29th, we have already issued a document to ensure minimum livelihood guarantee to people with difficulties. For example, we'll relax the restrictions to provide temporary support and subsidies to people with difficulties. Local governments abide by the document issued by the Civil Affairs have made some progress in taking care of the people with difficulties. To some extent, we could see some of the positive changes. For example, in the past, some people are earning a living by migrant workings and running a business, and some people are not able to go back to work because of the traffic control. And for some elderly people of no family in the past, they have some healthcare workers to look after them, but because of the epidemic, some people have to live on their own. And recently, we also realized that the Central Leading Group and State Council Interagency Task Force issued a document to ensure a minimum livelihood guarantee to people with difficulties. So in 5 areas, we could see the central government has attached great importance in this regard. So for people who need basic living allowance, it is around 47 million people. And on each year, we have to perform temporary rescue to 9.1 million people. So that is it is a heavy workload. We have also need to provide subsidies to orphans and also elderly person of no family, etc. For some hard-hit regions, we will increase the living allowance to those people. For example, in Hubei province, start from February the 20th, on each date, they will offer 500 RMB to people who are living in the urban areas and 300 RMB to people in rural areas. And we have to make sure that people's needs can be guaranteed as needed. Some people are living with difficulties because they're not able to go back to work and they cannot run their business. So we have to do what we can to include these people into the basic living allowance program. As I've just said, for some hard-hit regions, we will continue to run the basic living allowance programs in those regions. Because during the epidemic period, many people are living with difficulties. So at this point, we will not quit the basic living allowance programs in these regions. Also, we will strengthen our work to provide temporary social assistance and security. And for some impoverished households, if there are some family members being infected with COVID-19, we will also offer a stronger living allowance to those people. And for some families, maybe some of the key labor forces were infected by the COVID-19, and we will offer more support to those households. And also with some families, there may be some family members deceased because of the COVID-19, and we will provide more living allowances to these households to ensure their daily lives. And also we will provide more support to the non-local residents who are stranded in Hubei province. For example, we will attend to their accommodation, their meals, and also to ensure their daily necessities. And also we will grant some cash to provide some non-local residents. For example, some non-local residents have already stranded in Hubei province. They are not able to find a job and they cannot be supported by their families. So we will provide some cash subsidies to these non-local residents. And in Wuhan City, each one of these people will be granted with 300 RMB. And also this policy will be applied in other regions. And also, we will provide basic care services to these people with difficulties. And for some quarantine centers, These centers need to ask the patients who are being admitted to understand their family situation. For example, these patients may be a healthcare worker. If they're admitted in a quarantine point, so some of the work of the basic care may be suspended. And also, we will attend to those people who are staying in their household. For example, the elderly person of no family, orphans, left behind children, and left behind elderlies. We need to pay frequent visits to those people to understand their health conditions. So my question is about the charity and donations. Some people may find some problems or challenges in making the donations and the allocations of the donations. For the Civil Affairs Ministry, how can you deal with those problems in relation to those charities and donations? Thank you. I will take this question. I would like to say 4 things. During the epidemic period, we could see the enthusiasm of our people in participating in the charity program and make donations. As of yesterday, the total amount of the donations amounts to 29.2 billion yuan. And also the year-mark donation amount amounts for 22.3 billion RMB. This can show the enthusiasm of our people for the charity and the donations during the epidemic. And second, by looking at the donation, we could see the charity agencies have done a lot of work. For these charity agencies, they have created a strong synergy between the people who made the donations and the recipients. That is to say, these agencies have done a lot of work. They are united their actions together with the CPC as well as the State Council. So we have formed a strong synergy to fight against the epidemic. Third, this time we still have some room for improvement for the operation of the charity agencies. For example, we could see a poor efficiency in allocating the donations, and some of the informations are not transparent. So we have to encourage these charity agencies to strictly abide by the laws and regulations when performing their duties. And also, during this epidemic period, we could see there's still room for improvement for the government to strengthen their supervision against those charity agencies. The Civil Affairs Ministry has attached great importance to this issue and also offer guidance and instructions to the charity agencies and the Red Cross Society. We'll endeavor to streamline our processes and correct all the wrongdoings. Going forward, we will continue to draw on the experiences and improve the authorities' capability in handling with the public health emergencies. This is a big task for all of us. Let's work together to resolve all of these problems. Last two questions. With China Daily, in prevention and control work of the epidemic, some of the frontline community workers have made a lot of contributions in containing the epidemic in urban and rural areas. So what measures is taken by the civil affairs to support the frontline community workers? Let's give the floor to Mr. Chen. Thank you for your concern about this issue. Regarding the document on measures to support the frontline community workers in urban and rural areas, the Central Leading Group and the State Council Interagency Task Force have met the needs for the frontline community workers. Going forward, the Civil Affairs Ministry will fully implement the requirement from the document. First, we will strengthen our sense of responsibility. The Civil Affairs Ministry has already issued a notification to ask the localities to shoulder responsibilities. And it is a political task for all of them to provide support and care to the frontline community workers. And also, we are rolling out several measures to attend to those frontline community workers. And also, we are working on implement some measures to ensuring living allowances to the frontline community workers in urban and rural areas. Also, we will strengthen our efforts in the coverage. For example, we will publicize some of the current situation in the urban and rural areas, and sharing some of the touching stories of those frontline community workers. At the same time, we also learn the experiences from other regions and to strengthen our support to the frontline community workers. Third, we will establish a special task force to coordinate with relevant departments and to organize a reward ceremony to the frontline community workers and to set up role models among the frontline community workers. Fourth, we will strengthen our implementation of these measures. We'll work with localities to roll out targeted policies to address the concerns from the frontline community workers. And also, we will establish a working mechanism for the frontline community workers and set up party committees at all levels, and to provide stronger compensation package to these community workers. At the same time, we will set up a mechanism to better select and train the community workers so as to improve their working efficiency. Fifth, we will provide the guidance in getting more donations to support these community workers. We have working with several charity agencies and ensure the living subsidies and also the support for people who are working in the elderly care institutions and welfare institutions at different fronts. And also, we will evaluate the psychological condition for the community workers. After the epidemic, we will run work rotations to the community workers to make sure that these people can be relaxed after the epidemic. Thank you.
谢谢香港中评社提问。请问养老机构在疫情的防控工作中都遇到
My
哪些困
question
难？
is also relates to the elderly care institutions. So what challenges has been faced by the elderly care institutions and what measures has been taken by the Civil Affairs Ministry?
是否能够有效地解决这些养老机构所遇到的困难？
So can we address all of those challenges that has been faced by the elderly care institutions? Thank you.
我来回答这个问题。这个咱们知道，这养老机构呢，
So I will take this question.
封闭的一个相对独立的一个单元。那么它的特
Actually, for the elderly care institutions, they are independent institutions
就是多数咱们
and it's not open to the
一般
public.
的都是两个人一个屋，甚至有的
And
像那个私人的
many people are actually living under the same unit.
就是4、5个人，甚至于更多的一个大的。
For some rooms, there maybe have 4 to 5 people.
再一个呢，它
This
这
is
个
one of the features for the elderly care
包括
institutions.
相互之间工作人员的这个接触是非常频繁的，因为刚刚说养老
And also for the elderly people, they have very frequent contact with the health workers. As I've just said, some of these people are
要有人跟
in serious
生活的料理。
conditions, so they're not able to look after themselves. They need these health workers to look after them for 24 hours.
这是
So this kind of contact is face to face, and it is a very intimate
它要
contact.
好多
And for each one of the health workers, they have to look after several
养老院的这些
people.
他一般都是刚才说的年纪比较大，再一个很多
And for people who are living in the elderly care institutions,
就带
they're quite senior in their age, and they're not able to look after themselves, and also they suffer from some chronic diseases.
老人，他是
So all of these
相比较而言，他容易有这个感染，而且一旦感染上的话，他这个就是交叉的，
make this group more vulnerable.
引起并
If
发
one
症
of the
引起并发症的。
elderly people being infected, and it is likely that other people will be infected.
这个
And some people may suffer from complications brought by the
再一个
COVID-19.
风险很大，风险很大，所以造成这个
So it is of high risk to work in the elderly care institutions.
疫情防护的工作是从对象上来说，从机构上来说都是一个
That's why we think the epidemic prevention and control in the elderly care institutions is more challenging for us.
那么围绕着这一块呢，民政部已经采取的这个措施主要是一个是
For the Civil Affairs Ministry, we have already rolled out a series of measures.
封闭管理的这个
First,
措施，
we implement a close-off management for these elderly care institutions.
各地的实行严格
We issue the document on January the
再一个
23rd
呢，
that all elderly care institutions across the nations will be
防控的指南，
under close management.
就是从这个
And
组
also
织
we
架
are
构
we are launching a technical guideline
这个护理
for the operation of the elderly care
这
institutions.
个内部的管理，一直到疫情的处置。
For example, we have to strengthen the internal management of the institutions and strengthen the protection of the healthcare workers. So it is a very detailed technical guideline for the operation of the elderly care institutions. And also we have made some revisions on the guideline.
疫情的发展的情况，疫情发展情况
On February the
更加
5th,
提出了一个更加
alongside with the development of the epidemic, we are
和有疫情的，就是有感染的养老机构的
implementing more stringent
这样
management
的话呢，就是
of the elderly care institutions.
更加精准的进行工作的这个指导。
That is to say, we are taking a strict and targeted measures to manage all of these elderly care institutions. And also, we strengthen our supervision for the elderly care institutions across the
再一
nation.
个呢，就是派出工作组，民政部派出
We are also
高校
sending
兵副部长带队
task
工
force
作组直接到武汉，
to elderly care institutions in Wuhan.
在内的其他的一些民政服务机构的，就是实地的工作的指导。
And the task force will conduct field trip and provide on-site guidance to all of those welfare institutions, including the elderly care institutions. And also, we are dispatching the working group to other provinces for further guidance and instructions. And earlier on, we also organized a video conference call with over 70,000 participants so that we will discuss the issues in relates to the elderly care as well as the children care. So by having all of those measures and efforts, we could see there may be some positive changes. So all the localities will strictly abide by the measures that has been launched by the Civil Affairs ministries. And some of the elderly care institutions, they realize zero infection. If there is some infections in some of the care institutions, we found that these people fail to perform some of the duties that has been listed by the measures released by the Civil Affairs Ministry. You also mentioned the document delivered by the State Council Interagency Task Force, the document on epidemic prevention and control in civil service organization. I think this document is very important for us because we could see the elderly care has been included into one of the key tasks for the State Council Interagency Task Force. So this has strengthened the leadership in managing the elderly care institutions across the nation, and also for the quarantine, treatment, rescue, and the supplies, relocation. All of these aspects have been strengthened. By doing all of that, it could help us to enhance the capability to improve the elderly care service. In the future, we will take targeted measures by regions and risks, and also we will resume the work of the elderly care service in an orderly manner. But of course, we have to consider the actual situations in different regions. At the same time, we will attend to elderly person outside of the elderly care institutions, because there are many elderly persons of no families who are being quarantined. That is my answer. That's the end of the press conference. Thank you.